Welcome to Future Talk. We've got a great topic today, the human mind. It's one of the most important areas in all of science, but also one of the most difficult to study. I have two guests from the field of neuroscience who are going to share their insights. Michael Merzenich is a professor emeritus of neuroscience at the University of California at San Francisco. He's won many awards and honors for his work and is especially well known for his work with brain plasticity, meaning the ability of the brain to adapt itself physically when the need arises. Simon Tan is a clinical psychologist and neuropsychologist at Stanford Medical Center, where he specializes in the diagnosis of developmental, psychiatric, and neurologic disorders. He also maintains a private practice in neuropsychology. We'll be discussing the latest advances in neuroscience, how learning and cognition work, common impairments of the mind, and also the untapped potentials of the mind. Gentlemen, welcome to the program.
Nice to be with you, Mike.
Thank you very much.
Michael, let me start by asking you this. Is there a difference between brain and mind? Are they synonymous or are they different concepts?
So when we see the brain operating in thought, and one of the fabulous things about contemporary science is we can actually witness the brain in operation in thought or in the control of action or in the reception of information from the world. We see no real distinction in the machinery that's engaged, and we see no real distinction in the operations of the machine that's engaged in these different levels of operation. So when you're solving a problem, when you're thinking through your ideas, when you're of course different, the machinery is engaged in different ways, in different proportionalities you could say, but the actual physical machine is essentially the same. So we see the operations in a sense of what you would call the mind coming out of the operations of the physical brain.
Can we draw a parallel with computers, for example, and say that the physical brain represents the hardware and the mind represents the software, the thing that drives the hardware?
Well, that's not really, I think, a correct distinction, because when we see the physical brain in operation, of course we see the information flowing across the machine like the information would flow across the computer. In that sense, you could say that it's like the activity that's flowing across the computer. The difference, though, between the brain and a computer is that the brain is biological. It's not a fixed, permanent structure. It's actually revisable in a life, and it's actually being continually revised in life. So it's not like the computer, not hardbound, not hardwired like the computer on your desk. I like to say it's soft-wired.
Now, is that the concept of plasticity that you've worked on, where the brain can create new neurons and new connections?
Absolutely. That's exactly what it does. Each time you improve at any ability, or each time you acquire a new skill or ability, the brain is actually revising itself. It's actually changing its wiring and its functionality, its physicality, in ways that account for the improvement of the skill or the development of a new skill.
Now, what's the most important question that you're trying to find the answer to in your study of the brain?
Well, I'm interested in plasticity as it contributes to the origins of human behavior and as it accounts for the incredibly wonderful expression of individuation in behavior. We're all different because our brains have all evolved in an absolutely idiosyncratic way. Every human being is different in the physical brain they carry around within them because it's plastic, and its actual functionality is based on billions of events of change. But I'm also interested in marshaling this science to try to drive change in brains that are struggling or straggling, you could say, people that are suffering in life, or people that are struggling in life because of problems that come from neurology that's distorted or dysfunctional. And that applies to about half of us at some time in our life, in our human existence.
Now, would this be a physical problem with the brain? You know, the brain is pretty well protected. It's inside the skull. There's not too much harm that can come to it. So what would go wrong with the brain?
Well, even in intact brains, there's all kinds of things that go wrong. The brain has failure modes. Because it's organizing its own activities, and they account for our functional operations, it actually can drive itself into a ditch, you could say, in a lot of ways. And we have grand names for these conditions. We might call them bipolar disorder, or schizophrenia, or depression, or obsessive compulsive disorder, or ADHD, or hundreds of other labels that we put on these things. And in fact, in every one of these instances, the brain basically has been driven in a distorting direction. And we can look at the brain functionally and physically and see that it is driven plastically in a distorted direction, in an abnormal position. And one of the things we're trying to do in our science is to actually marshal the forces of brain plasticity to drive it back correctively, because we have this power to change. How much can we change it correctively to drive the brain back as far as possible in a renormalizing direction?
Now, how would you change your brain? Would it be through the conscious process where you tell a person, you need to start thinking this way?
That's our primary strategy, is to train the brain intensively. And we understand the rules of plasticity. We understand the rules that govern change in a normal life. And using modern technology, we can actually bring those plasticity processes under control and with high efficiency, drive brains in many dimensions in corrective or strengthening or recovering directions.
Now, sometimes as people age, they develop brain problems like Alzheimer's, for example. Right. Is that something that's on your radar for possibly fixing, finding out why it happens and making sure it doesn't?
Once the illness arises, it's very difficult to repair the brain because a lot of bombs have gone off a little. The pathology itself can be massively destructive. But the brain actually in its powers, a lot of things can be done to increase resilience, that basically put the brain in a safer position. So one of our fundamental research efforts is directed towards trying to increase that safety so that people live longer lives, you could say, that before the emergence of Alzheimer's disease, and potentially prevent its onset in almost everybody to the end of life.
Now, how do you study the brain? I assume that you can learn more by studying live brains than studying dead brains, and you put electrodes on a person's skull and watch the reactions?
Well, we have wonderful recording and imaging strategies in which we can actually look in the brain while the brain is in action. And we can see the brain and actually record its responses as you're responding, as you're making decisions, as you're in complex operations in controlling your actions or controlling your thoughts. And we can see that we can define not just normal actions, normal reactivity, normal patterns of connection, normal patterns of operation, normal physical brain, but we can also see all kinds of ways that a brain that's struggling can be distorted or is distorted. And that gives us a blueprint about how we might think about correcting such a problem in a living individual. And we can actually do this in an individuated way. We could look in your brain, define your strengths, in a sense record your weaknesses, and use that as a strategy if you're struggling especially to try to drive corrections to help you.
Can you learn much about a brain just by looking at the brain if you don't know the individual in advance?
Oh, a lot. A lot, because you can drive the brain in the domain of functional assessment. And when you can look at the capacities of the operations of your brain as you are being, in a sense, assessed or evaluated in your performance, we commonly use strategies in which we're measuring your behavioral performance abilities, of course. But we actually can learn an awful lot about your operational powers by looking at the physical and functional brain, about how your brain is operating itself, your brain in front of us. We can tell a lot about you, Marty.
Well, that's good to know.
We won't tell anybody else.
Okay. Now, Simon, let me ask you a question, because you're a clinical neuropsychologist. You deal with patients.
Right.
What are some of the common problems that people come to you with?
Well, I think virtually everybody comes in saying that they have an attention or a memory problem. And for me, as a clinician, the main issue is to confirm or disconfirm their concerns. And it's not that easy many times to know from just meeting the person. I think that's where diagnosis is very important in my line of work, because many people can come in and they have a lot of concerns, but then some may be unwarranted in the sense that they're not diagnosed with any particular disorder. And then you have somebody else who comes in and they have minimal concerns, yet they show little insight into the difficulties that he or she has in everyday life.
But if they're coming to see you, they must have a symptom of some kind that they're concerned about.
Well, it would be something that either he or she is concerned about or the family member is concerned about. So the main issue for me is who is coming in. Is it the patient who is having the complaint, or is it the family member who's voicing the complaint? And that question actually tells me a lot about what kind of diagnosis I'm looking at.
Now, do you often diagnose things as a physical problem with the brain? There's something physically wrong with the brain, or is it often more of a thought problem? The person is just not thinking right. They're not framing their life in the right framework. They're not keeping things in the proper proportions.
For me, it's probably the latter, because I see it from a more functional perspective. It's really their cognition and their emotions. And it's interesting because many patients think, well, if I have problems, they should manifest itself on a brain imaging scan, so that there should be a strong correlation between what you see on a photograph and what you see in real life. But the truth is that many times there are discrepancies, so that many patients who I see, their brain scans are totally clean. Yet when you ask them how their life is, they say, well, I'm forgetting everything. I can't manage my bills. I can't take my medicines on time. And it's all true because it's validated and corroborated by family members. So from a clinical standpoint, it's very interesting to see the discrepancy between a physical, issues physically and issues from other perspectives.
Now, if it's not a physical problem, is there still something you can do to treat it? It's still a problem.
It's still a problem, and many times it's really what gets manifested first. So I do see many people with neurological disorders like Alzheimer's, but other types of dementias. And it's very difficult to sort of generalize and say everybody comes in with this profile. Some people may come in with a memory concern, but then later they develop a physical problem. Another person comes in with problems walking, and then 2 years later, they develop a memory problem. Both individuals may have the same diagnosis, but their developmental course is drastically different. And as a clinician, the ideal, the purpose is to say, well, these presentations look very different, but they're actually looking at the same diagnostic entity.
Now, there are certain mental problems that are fairly common. For example, many people are troubled by disturbing thoughts that they don't want to have in their head, but they can't seem to get rid of them. Would that typically be a physical brain problem or something else, some kind of thinking problem? And is there anything that can be done for that?
Well, I think there are definitely issues related to brain circuitry that could account for somebody maybe getting stuck in a certain kind of thought or a certain type of behavior or some sort of maladaptive pattern. And there are many types of therapies that say, well, condition you to do a certain type of intervention. So like in behavioral therapy, they say, well, if you have a negative thought, sometimes say stop, or use a rubber band against your wrist and then hit it to sort of get you back into the right frame of mind. But I think maladaptive thoughts, it's really sort of, to address them, you have to sort of, I think on some level, you have to unlearn what is negative and then learn something that is positive or adaptive.
And Marty, that unlearning actually requires the brain to be changed physically. When you look at the performance of any brain and you see that the performance is distorted or limited in some way, that is sine qua non evidence that the brain, in fact, is physically distorted to some extent. And when you look at specific populations in there are thousands of studies like this. And look within the specific dimensions that describe the condition that the person has, you see those distortions expressed in their circuitry. So the brain in a general scan may look very normal, but in detail, the brain is functionally distorted in its connectivity and its wiring.
So you can see something as small as individual neurons and axons firing and say that one looks like it's firing wrong?
Well, commonly we look at, and there are many instances in which that's been studied, but primarily not so much in human models because it's difficult to record on that level from the human brain. But we certainly do see gross differences in the basic strengths of wiring patterns and the patterns of connectivity in brains that distinguish one neuropathological condition from another.
Well, do you think that people are capable, at least theoretically, of programming their minds, of choosing their attitude and their outlook and setting their minds instead of saying, well, I just passively become whatever the world buffets me into becoming?
Well, the brain is plastic, Marty, and actually it's under our control. And we have the capacity to change it. Now, it's not always easy for the average citizen to understand what they would need to do to drive change. And psychologists, therapists have devised strategies. Basically, their strategies are effective because they engage the person in ways that can drive change. We're just beginning to learn, in a sense, how to control the genie. And that's now where a large part of the research in this practical scientific area has been directed. we're understanding increasingly when we see a brain that has a particular pattern of distortion, how to drive it correctly in ways that advantage and correct it.
Do you think we might someday get to the point with enough understanding that there will no longer be such a thing as a neurosis or a psychosis? Is that theoretically possible?
I mean, I think theoretically it's possible. I think we're kind of far away from that. And
I don't think we're so far. You know, we're now running an FDA trial. We're in the midst of an FDA trial, a research group that I'm working with, on the treatment of schizophrenia. We can have very large impacts on the expressions of schizophrenia in an active schizophrenic patient. And we've looked in a number of ways in the brains of these patients, and we see the brain of the schizophrenic patient with training, particular forms of training, of course, looks substantially normalized in the areas that we're targeting. Now, we haven't trained completely enough to drive the brain and so that we can say that we can reliably, quote, cure the condition. But I absolutely think that that is in the realm of possibility, that we'll see that probably, if not in our lifetime, not too far into the future.
Now, is schizophrenia basically a matter of, multiple personalities? Each one doesn't know what the other one is doing at any given time?
I think in the past, I remembered supervisors of mine who thought schizophrenia was a personality disorder, and in which it was willful. But I think sort of the more, the latest notion is that it's a biological disorder, but it also has, environmental underpinnings, and so it's multifactorial. And schizophrenia, I think, is a very complex disorder to study. But then I think many neurological disorders are in that category as well.
There's a lot to train, but let me just point out another prospect about even something as complicated as schizophrenia. If you have schizophrenia and you have an identical twin, there's a less than even chance the identical twin will develop the disease, which means that there are factors in life, in environments that contribute to onset. And the simple fact is that treating schizophrenia is incredibly complex because with our sort of strategy, because there's a lot to fix, there's a lot to change. The brain is massively distorted. But on the other hand, preventing its onset, increasing resilience in an at-risk individual, doing enough in the environmental interaction of that individual in their brain to change it enough to make it more resilient against the onset. Now that's much more practical. And I absolutely believe that is something we will see in the next decade. We will see strategies, we are already seeing strategies by which we know we can delay and probably prevent the onset of schizophrenia in many individuals that would succumb to it.
Now, what are the most promising methods? Is it pharmaceutical drugs or talk therapy where they talk it out until they get some insight on their own? What's the most promising approach right now?
I'm not sure if there's any single one approach, and I think there are many out there. In types of disorders that I see, I don't think necessarily talk therapy would be very helpful for somebody with Alzheimer's or Parkinson's. I think a lot of the literature has talked about physical interventions, so aerobic exercise, but getting your body to move. There's a lot of information about somebody with Parkinson's disease that dance therapy or other types of movements can really help the person. And I think that's something that many people are looking into, and I think it's really a complement to what's existing in terms of, the cognitive retraining. I think, it's something that warrants further investigation.
I think there's tremendous hope there, and I think that in these therapeutic strategies, I think that in fact there's a kind of revolution that's beginning to occur in which we're understanding how to drive the brain correctably, as in so far as it's distorted in a variety of neurological and psychiatric conditions, and that it will be largely marshalling brain plasticity. When you think about something like dance therapy or movement therapy, remember there's a brain involved, and you're actually driving changes in the brain that are strengthening it, that are increasing its operational capacities, conceivably increasing resilience. So we're understanding increasingly how to control these to make a brain that is weak, that is in danger, put it back in a stronger and safer position.
I think the one thing to remember, and I think it comes from what you asked about, the difference between the mind and the brain. And so, and from my point of view, I think the brain, I think of it as much more, it's sort of an organism. But the mind, and this was touched upon, I think, earlier, but, the mind is more individualistic. And I think, it's very difficult to sort of generalize to all minds because each mind is different. And I think that's why to have one intervention that will capture everybody, I personally don't think it's really possible.
Well, let me ask you this. What do you think are some of the upper potentials of the mind? We've been talking about impairments and how to solve them, but do we have mental abilities that we're scarcely aware of? For example, certain musical composers just hear a symphony in their head and they write it down. They don't even think that they composed it. It just came to them from somewhere. Is this the sort of thing that anybody could do in theory, or people who perform amazing feats of memory, like the chess master who plays 10 games of chess simultaneously while blindfolded? He's got 10 chessboards in his mind. When an opponent announces his next move, he visualizes the move, visualizes his counter move, then goes on to the next board, and when he returns to this board, it's still there.
I'd like to say that no such thing comes from nowhere. It comes out of a person's individual experience, and in a sense it's hard-won by the engagement of their brain. So if you look at the chess master at their hippocampus, which is basically controlling the brain's controlling the relationship of things in space and time. Chess masters have an enlarged hippocampus. They have a bigger, these operations in their brain are more powerful than they are in your or my brain because they've exercised the blazes out of it. If you look in the area that we use to recognize faces of individuals, they use that area in a heavily specialized way to recognize the patterns of a chessboard. And you can actually do experiments that show that they have powers. They basically have a chess master brain you do not have. Well, maybe you do have, Marty, but I don't have. And the point is that we have these capacities for very substantial exploitation because our brain is plastic, to drive these special abilities. And anybody that's a master at anything has in fact created that mastery by changing their brain in a progressive way in their lifetime.
Now, if you want to maximize the potential of your brain, is it a matter of treating the brain like a muscle that you always have to exercise and make stronger? Or is it like looking through a dirty window and you just have to wipe the window clean so you can see clearly through it?
Well, I think it's like a muscle in terms of you have to condition it, you have to take time to sort of rear it and to sort of mold it. And so I think that's true. There's a lot of effort and time that needs to be put into any sort of intervention. But as I mentioned, sort of wiping the slate or wiping the windshield, there are many maladaptive things that we learn throughout our life. And for many of us, you may need to take time to unlearn those kinds of behaviors, and that takes time. And so it's really a process where many times it doesn't happen overnight. And for some people, it may take many years for them to sort of get to a level that is functional or that they find desirable.
What do we understand about consciousness itself, if anything? I realize this is a hard question. There are no good answers. But I'm just tossing it out there in the hope that maybe something will come out. What do we mean when we say that somebody is conscious?
Well, of course, you can look in the brain when a subject is aware, and you can see that there are certain operational characteristics in play that are associated with awareness. So we have a lot of correlative information. We know a lot of ways to alter consciousness. We know a lot of ways to destroy or kill it. And so we have a level of argument about consciousness arising from the brain as a product of physical processes. All of the studies, though, argue about its nature by these sort of parallel correlative arguments. We really don't understand the nature of that present awareness. We don't really know where the spirit comes from, in a sense. But we certainly do. There is a lot of evidence that it's springing out of the brain as a product of a physical process.
Yeah, because there's also a school of thought that says that thought itself is a fundamental property of the universe, not just an electrochemical byproduct of something else.
And on the other hand, when I'm in thought, I can see activities move across the brain. So I can do this in a very controlled way in a brain. And I actually can see the brain move its way across a problem or solve a problem or make an association or draw a relationship. I can actually see those activities in the brain and understand on a sort of elementary level how the brain is achieving those things. So on the one hand, we can say, well, it's all mysterious and somehow it's above the physical operations of the brain. On the other hand, I can look at activities in brains and I can actually witness things happening that are clearly happening in parallel with those operations.
And what about intelligence? Most people assume they know what intelligence is, but I gather it's not quite that simple? Is it a single trait or a combination? What does it mean when we say somebody is really intelligent?
Well, I don't think you can get any one definition of intelligence because there are many different types of intelligence. Some people are good at music, some people are good at art, science, and I think intelligence is really sort of, if you have to take a step back, intelligence is really sort of, adapting and choosing, selecting your environment. And I think the people who are good at that particular skill are intelligent. I think intelligence means different things in different situations, with different people. And really, it attests to, for any one individual, how adaptive they are to different things that come up in their life.
Is it largely about pattern recognition, the ability to tell how things are alike and how they're different, and organize the world in terms of differences and similarities?
There are also more elemental things that relate to it. How fast are the operations of the brain? How fast can it move across the possible solutions to a problem? The number of answers when there are many alternate answers. How well is the brain recording information? How reliable are its operations? How stable are they? All of these things contribute to its operational effectiveness. If you want a general definition of intelligence, it is operational effectiveness, and you could say you carry it to the level of complex problem solving. And of course, but to do that, for a brain to be facile as a complex problem solver, it has to have very good, very stable, very high fidelity elemental operations. So it's actually built on a large pile of critical fundamental skills and abilities. All of that grand complex operational ability comes out of having a very facile treatment of all of the elements. It's like learning all of the elemental skills of mathematics before you can really operate at a high level. Your brain is constructed that way. It constructs all of the elements. When they're in tip-top shape, then you have real powers to grow from.
And I'd love to get into that in more detail. Unfortunately, this half hour has gone by far too quickly, so I'm afraid we're going to have to come to an end. I'd like to thank my two guests, Michael Merzenich of the University of California, San Francisco, and Simon Tan, clinical neuropsychologist at Stanford Medical Center. Thank you for watching. Visit our website, www.futuretalk.net. For Future Talk, I'm Marty Wasserman. See you next time.